Dental and gum disease is the most frequently occurring clinical condition in dogs and cats. 4 out of 5 dogs over the age of 3 show signs of disease. Plaque hardens and forms into tartar. Left untreated, this leads to gingivitis, a painful condition of inflamed gums and periodontal disease. As a result, your pet experiences pain, just like a bad toothache, bad breath, and potential tooth loss. The bacteria found in the mouth can also have an impact on organ function throughout the body. So how do you know if your pet has gum disease? Often the early telltale signs are not obvious at home. Thus, regular dental checks by your veterinarian are essential. In some instances, you may notice the following signs of early dental disease: bad breath, discoloured teeth, gum recession and sensitivity. Or in much more advanced dental diseases, we see more severe signs such as pouring at the mouth, facial swelling, excessive drooling, inflamed and red gums, reluctance to chew or eat, pain when handled around the head, and behavioural changes. Once gum disease is present, an electronic scale and polish is often the only way to remove built-up plaque and tartar. This procedure is similar to that performed by your own dentist, using modern dental equipment and treatment methods. The main difference is your pet will need to be hospitalised and receive a general anaesthetic, as it is impossible to ask your pet to stay still for thorough dental therapy. Once your pet is anaesthetised, we manually and ultrasonically scale your pet's teeth to remove plaque, tartar, and infection above and below the gum line. This needs to be done thoroughly and can be a time-consuming process. If we find any loose or badly infected teeth, they will also be removed. Finally, our high-speed polishing tool is used to slow further plaque development and to give your pet lovely, shiny white teeth. A regular dental scale and polish is the best way to maintain clean teeth and a fresh breath.